analysis that we did of all of the HPV-negative cases in the CARIS head and neck cancer database. So this is a series of 1,010 cases, all of which underwent genome profiling with a CARIS panel that has 592 genes in it. And we started out by looking at P53 mutation status. And then we looked at the second most common mutation in HPV-negative cancer, which is in CDKN2A. We looked at tumor subsite. We looked at patient gender. We looked at the tumor mutation burden by P53 status across a number of different algorithms for calling P53 mutations. So we started with the CARIS algorithm, which essentially calls all variants. We then looked at the IARC class. We used the POETA algorithm, which had previously been published in head and neck cancer to be very informative for prognosis. And then we looked at the calling of gain-of-function mutations. And so very interestingly, when you looked at gain-of-function mutation that was not associated with tumor mutation burden, kind of supports the underlying hypothesis. But across all the other algorithms, P53 mutation was, and it was the strongest association was seen with the POETA disruptive algorithm that we had published previously. We then looked at CDKN2A. This did predict a higher tumor mutation burden. And then very interestingly, across many of the algorithms, the coexistence of P53 mutation and CDKN2A mutation was most strongly predictive of a high tumor mutation burden. So I think some of the questions that investigators asked us about our findings, one was